In this video, we'll talk about hemophilia. It is an hereditary coagulative disorder. Here, the intrinsic pathway is affected. Extrinsic pathway is normal. There will be mutations in the factor 8 and 9, which leads to the defective intrinsic pathway. Overall, defective coagulation leads to the prolonged bleeding, which can be fatal. The inheritance type is X-linked recessive. Hemophilia can be of two types. One is due to the hereditary cause, hemophilia type A, hemophilia B, von Willebrand's disease, and it can also be acquired, such as DIC, vitamin K deficiency. With the family histories, males and homologous females are affected more than the heterozygous females. These heterozygous females will be the carriers, and which passes the disease in the future generations. Without the family history, it is due to the mutations in the factor 8 and 9. So the level of factor 8 versus the severity of the disease. Less than 1% of factor 8 causes severe disease. 2 to 5% of normal levels causes moderate to severe disease. 60 to 50% of the factor 8 or 9 of normal levels causes the mild disease. Clinical features: bleeding, hematoma, hematuria, hemarthrosis or oropharyngeal bleeding, intracranial bleeding. That means there will be the excessive hemorrhage. Lab diagnosis: prothrombin time is a measure of extrinsic pathway. So as we discussed earlier, extrinsic pathway is normal here. So the prothrombin time is also normal. APTT, activated partial thromboplastin time, is a measure of intrinsic pathway. As we discussed earlier, intrinsic pathway is affected. So the APTT is prolonged. Bleeding time is prolonged. Factor 8 assay is done in hemophilia type A. Factor 9 assay is done in hemophilia B. Blood volume is decreased because of the blood loss. Hemoglobin is also decreased in proportionate to the blood loss. Platelets are normal, it is not affected. So family history should also be taken when the patient comes to you. A genetic analysis can be done. Prenatal test is performed in the pregnant woman who is the carrier with a history of hemophilia. So it's also called as hemophilia gene test. Treatment: for type A is the deficiency or the mutation of the factor 8. Type B is the deficiency or the mutation of the factor 9. The cryoprecipitate of the factor 8, infusions of recombinant factor 8, fresh plasma derived factor 8. For the type B, fresh frozen plasma of factor 9, infusions of factor 9. So post-therapy complications. So plasma infusions have a high risk of HIV. So this is seen previously where the hemophilics got infected with HIV due to the repeated plasma infusion. Type B is also called as Christmas disease. It is caused due to the deficiency of factor 9.